Hello and welcome. If you're getting ready for spine surgery, it can definitely feel like a lot. So today, we're going to walk through a step-by-step guide to make this whole process feel way more manageable.
And let's just be real for a second. Getting ready for any surgery, especially something like spine surgery, can be completely overwhelming. I mean, there are so many moving parts, and it is totally normal to feel a little bit anxious.
But here is the absolute key, the main takeaway for everything we're about to talk about: being informed and organized. Well, that's your superpower. It's how you take that feeling of being overwhelmed and flip it into a feeling of confidence and control. Okay, so let's jump right into phase one. This all starts weeks before your procedure, and it's all about one thing: gathering the information you need to feel like you're truly in the loop. A simple list of questions like this one can be unbelievably empowering. Don't feel weird about writing these down and taking them with you to your appointment. Seriously, understanding the details from the exact name of your surgery to what a potential complication might look like, that's the first huge step in taking charge.
And one of the biggest questions you'll ask is about your hospital stay. Are you going home the same day, or are you staying for a night or two? Because the answer completely changes how you need to plan. An outpatient procedure means your at-home support crew needs to be ready to go from hour one. An in-hospital stay, on the other hand, gives you a bit more time with medical staff right after the surgery.
It's also really helpful to get comfortable with some of the lingo. For instance, your surgeon might say you're having a laminectomy. All that means is that they're removing a tiny piece of bone to create more space for your spinal cord or nerves. See? Understanding these terms just helps pull back the curtain on the whole thing. So now that you're armed with all this great information, let's build on it. The next step is all about turning that knowledge into action by getting your home ready for a safe and much smoother recovery. I'm telling you, a few simple tweaks to your home before surgery can make a world of difference after. Your mobility is going to be limited, so just think through your daily routine. Moving the coffee mugs and cereal to waist level saves you from painful bending. Prepping some meals ahead of time, well, that's just a gift to your future self. And clearing pathways is just a smart, simple way to lower your risk of a fall. Okay, this one is huge. You will not be able to drive yourself home. It's a non-negotiable safety rule. So you've got to line up your support system, your friends, your family to help with that ride, and ideally to hang out with you for at least that first night. It's a really critical piece of the puzzle. All right, let's get into the final phase before the big day. We're talking about those super important instructions you're going to get from your surgeon's office in the days right before your procedure. I really can't say this enough. Following your surgeon's pre-op instructions to the letter is probably the single most important thing you can do at this point. Every single instruction is there for a reason, to prevent delays, cancellations, or complications. Your surgical team is going to give you a very specific list. And trust me, every item on it is critical. For example, they'll have you stop taking blood thinners to reduce bleeding risk. You'll have to fast after midnight. That's to prevent some really serious complications with anesthesia. And getting all your labs done makes sure the team has the most current picture of your health. It's not just a checklist, it's your safety plan.
So you've done all this amazing prep work for the surgery itself. Now it's time to shift our focus just a little bit to look ahead at what comes next: the recovery.
Yeah, it's so important to remember that the surgery itself, that's just the starting line. The real work, the healing, happens in the weeks that follow. So getting yourself ready mentally for that period of focused recovery is every bit as important as all the physical prep we've been talking about. Recovery is an active process. You're not just waiting around. Your care plan is your roadmap. It's almost definitely going to include physical therapy to get your strength back, follow-up appointments to make sure you're healing right, and, this is a big one, really specific restrictions on your movement. You'll probably hear about BLT restrictions. That's no bending, lifting, or twisting, to protect your spine while it heals. Look, by asking all those questions, getting your home ready, and following every single instruction, you're doing something really powerful. You're shifting from just being a patient to being an active partner in your own healthcare. And that proactive attitude can make a huge difference in how well you recover. So the real question isn't just if you're ready for surgery, it's how you're going to prepare. By breaking it all down into these manageable steps, you can really transform that anxiety into empowerment. Taking charge of your own preparation is truly the first and most important step you can take on your path to a great recovery.